I've certainly seen, I think, a lot of positive changes. More medical schools, nursing schools are teaching future healthcare professionals about addiction. So that's a great change in the right direction. I think there's more of a move towards evidence-based practice. Well, what do I mean by that? And we'll talk more about that, but including medications for which we have good data and science to support using medications to treat people, let's say, opiate addiction, alcohol addiction, or alcohol use disorder. And we're seeing more of a move towards harm reduction, meeting people where they are, not just leaving them there, but guiding them through with empathy and with evidence. So those are some real positives. That said, I think we still have a long way to go. And so that's why I appreciate conversations like this, where we can bring in people like your listeners so that they can get engaged and ask the right questions and go to the right resources for help.
You're absolutely right. It takes a combination of factors, and we have been lucky in the past few decades to see new advancements. I know we talked a little bit the other day, and I would love to hear some more of your perspective on MATs, or medicaid-assisted treatment.
Yeah. When I was coming up in the field, that's how it was explained to me. MAT, medication assisted treatment. But over time, now that I've spent so much time in learning the data, learning about what's effective, what's not effective, part of it is also just language and the importance of using non-stigmatizing and accurate language. And part of that includes medications. So in the addiction field, we're trying to move away from MAT as medication assisted treatment and instead say medication for addiction treatment. So what's the reason for that? Because we know that medications such as methadone, buprenorphine, commercially known as Suboxone, naltrexone, these are medications that are treatment. They are not assisting, like say assisting counseling or assisting previously, psychotherapy or counseling and therapy, which are all effective, but medications are just as effective as treatments, if not sometimes more. So that's why that language matters. And frankly, most people with addiction for which medications are clinically effective and clinically warranted, they are still not getting these medications, Jana. And when I think about, say, my patients with leukemia or lung cancer, I can assure you I don't know about most, but the recommendation is for them to get chemotherapy, surgery, radiation therapy, other nutrition referrals. There's a clear algorithm, and most people with cancer, the treatment path is clear. But with addiction, still, they're not getting the evidence-based treatment they need and deserve.